Hello and welcome to another episode of Sound Strategic. I am Meia Nouwens, and today's episode will be the first in a series of podcasts that will focus on COVID-19 virus and assess its impact on international relations and global affairs. The scale and severity of the COVID-19 pandemic has profoundly changed daily life on a global scale. These special episodes of Sound Strategic aim to provide timely and detailed insights into the political, economic, and strategic factors at work in the countries and regions affected by the virus. Our first episode will focus on the Middle East and how the geopolitical dynamics there have already worsened the spread of the virus. To discuss this topic, I'm joined today by Mahsa Rouhi, Research Fellow in the IISS's Non-Proliferation and Nuclear Policy Program, and Emile Hokayem, the IISS's Senior Fellow for Middle East Security. Welcome both.
Hello.
Thank you.
Maybe I'll just start with the status of the pandemic in both the Gulf and Iran, and where we are at the moment. What do you see on the spread of the virus in your respective areas of expertise? Maybe first starting with Emile.
In the Gulf for the moment, it doesn't seem like the virus has spread extensively. Of course, there are issues of testing, transparency of data, etc. But a number of Gulf states have taken early measures because of their special situation to prevent the spread of COVID-19. In particular, and that was quite notable, Saudi Arabia has decided to suspend religious pilgrimage in the holy cities of Mecca and Medina, a decision that required some political courage, given of how important this pilgrimage is to the community of Muslim faithful. Elsewhere, it really depends on the strength of the health systems and the monitoring systems. The UAE has a pretty sophisticated monitoring network, but they also were the most exposed country because it serves as a global hub for transportation, aviation, and so on. Their response has been gradual. They didn't go for an immediate large-scale lockdown. They slowly rolled out a series of measures. And at the moment, it seems that only a couple of people have died from the virus, and the numbers are, a few dozens, probably, around 100 or so there. Saudi Arabia is a much larger country, but not as central in terms of, global travel and so on. And because of the measures around the Hajj, it seems like Saudi has been able to contain to some extent this. Mahsa will talk about Iran, but just to make the link there, it seems like certainly not all, but some of the early infections in Bahrain, in Saudi Arabia, came from actually pilgrims from these nations who had traveled to Iran and come back. And because of the lack of measures on both sides at the time, the infection spread in a couple of regions in Saudi Arabia and Bahrain. But it's not, at the moment, it's not yet a crisis on par with what's happening in Europe or happened in parts of Northeast Asia.
And Mahsa, what about Iran then? The situation is very different as far as I understand it.
Right. So Iran actually was one of the hardest hit countries, and there was a lot of discussion about, how much of it was the mishandling or the lack of initial timely response to this issue. I wanted, before getting into some details about Iran's situation, jumping on something that was, quite interesting to me, which was Bahrain and Iran don't have any diplomatic relations, but yet, as Emile mentioned, there were cases, of Bahraini citizens that had spread the virus from coming to Iran for religious ceremonies, etc. That was what the Bahraini government said. So it emphasizes how much this virus is more of a global issue, and it was not to be contained within any country's borders. And so when we look at the problem of this virus is beyond borders. Like, we can't think of it as this is Iran's problem, or this is Italy's problem, or this is Vietnamese problem, etc. anymore. And it was, like that from the beginning. And I think the neighbors, Iran's neighbors, understood this quite early on and reacted accordingly and sent help, which we'll talk about this, I guess later about the cooperation. But I think it was important to sort of just mention this here. As of today, the official records of the illness in Iran is over 44,000 cases, and there has been more than 3,000 cases just in the past 24 hours. As of now, finally, the government has ordered sort of the closure of the roads to and from Tehran and the closure of the parks. Tomorrow, actually, would be April 1st, would be the 13th day of Nowruz, where Iranians traditionally all celebrate by going to outdoor spaces in groups. And this is what everybody has feared for days and weeks now, to make sure that this is contained. There are a good portion of the population who's abiding by this, but there's a good portion of the population who's also not abiding by these rules because of the mistrust that they have of the government and what the government instructs them to do. So that's so far the situation in Iran. I mean, there's a lot of grievances from the beginning and a lot of public anger of how this situation was handled and how the government, there were people raising these issues of why did the flights to China continue, even though many other countries at the time, stopped their flights to China. Why wasn't the city of Qom, which was the epicenter of the virus when it first started, not quarantined at the time? As it moved on, there's just so much of public anger against sort of mismanagement and mishandling, all of which I would say is valid concern and valid anger. And then there is the issue of obviously the limits that sanctions impose on the government and in general on even private sector, medical companies, etc., who are dealing with this. But I think another issue worth mentioning is that how much the NGOs and sort of the smaller public, like social groups, have been able to help with charity and help with the situation and provide relief. I mean, it's still not enough, but it's been really significant of how much of these efforts have happened.
That's a really good point, Mahsa, and thanks for going into such detail on it. I think I'm interested in this, in what you said about the public's mistrust of the government and its efforts at the moment, how that is expressed, and also almost this notion that the Iranian regime, with all its authoritarian tendencies, doesn't have control over flows of movement, for example, gatherings for Nowruz, to the extent that outside observers might think that it does, because of the nature of the regime. Could you go into that a little bit more?
Sure. So first, the mistrust, I think I should mention that this, we have to think about this virus in a little bit of a more of a context of what started happening in January 2020. I mean, Iranians were almost at the brink of war with the U.S., and so there was that prospect already, looming. And then it was the shutdown of the Ukrainian aircraft, which created an unprecedented mistrust between the population and the state. And it this was, I think, the underlying factor of why there was so much anger and also mistrust on the coronavirus issue. I mean, obviously, there were a lot of mishandling on this very specific issue that caused the mistrust. But I think this, on top of what was already existing, made it, made the public be very, very doubtful of what the government is asking them to do. And many say from the government perspective, because they're also part of it was because they're so strained by the sanctions from the U.S. and the West in general, and they're relying increasingly on China. They refrain from taking action in time. And I think one of the other points of grievances that I heard a lot from people on the ground was the fact that they were saying that why is it that we could not impose travel restrictions with China to the point that all of our, like Iran's neighbors, like the whole country was quarantined. All the neighboring countries closed their borders to Iran. And people felt like if the government had taken timely action in quarantine measures and in terms of travel restrictions to China, Iran would not. They basically took it as sort of a little bit of a national humiliation. Obviously, they understood why the neighboring countries took that decision, so it wasn't that, but they felt like this should not have come to this point. And in terms of not abiding by the regulations is also, I think, a good portion of the population sort of didn't take this very seriously as part of why they didn't believe, what the government is telling them. And so, they started, Nowruz is when people travel. And even though there was so much on the national TV and sort of, restrictions on only essential travel, there were so many reports coming out of people still, traveling to different cities north of Iran, which is where people usually travel during this time. They have very limited healthcare, and it barely covers their own population in that region. And for them to have a huge population to Iran and other parts of the country coming in and potentially spreading the virus was going to be a disaster. And so there was so much of controlling the roads, but still people will go, and it essentially created sort of lines and lines of people waiting to get through sort of security and pass through these roads, which created another nightmare scenario for the government.
Right. And so in terms of the relationship with the United States at the moment, how has the rejection by the U.S. administration of possibly lifting sanctions or easing sanctions at this point in time, how has that been responded to by the Iranian public? Is it working in the favor of the Iranian regime, whereby they can deflect to a certain extent the blame for the current situation in Iran?
Well, yes and no. So the regime, and particularly Rouhani's government, has been very much proactive in trying to create this narrative that a big portion of the blame lies with the sanctions and not with the government mishandling. But I doubt that the population is buying that, and I think that mostly people in Iran or the population are blaming both. They understand that there is a situation where they're being punished by an ineffective government and the U.S. administration with the sanctions. And so they're caught again, and this is like a classic situation where it happens over and over in different situations, where they're caught in between the mishandling of their own government and the pressure, the international pressure through sanctions. But it's a combination of both, and I think it's understood as being a combination of both. When people, worry about the sanctions and the effect it's having on their medical sort of supplies, they also at the same time blame the government for it, and not the sanctions. And I think this is one of the points that has been very much misrepresented in the media. There's two camps have been created, that either the sanctions are the problems, or if you're saying sanctions are creating problems, then you're ignoring the government corruption, the mishandling, or the other way around. Whereas really it's just a combination of both that is really hard hitting the healthcare system and the population, and I think it's a really important issue.
Right. Fascinating. Of course, while all of this is happening, there are other ongoing conflicts elsewhere in the Middle East as well, namely in Syria as well as in Yemen. Emile, could you speak a little bit as to how these current conflicts are being impacted by the global pandemic?
Yeah, there are several layers to that. I mean, the first one is that in both countries, both were relatively poor countries, although Yemen was considerably poorer than Syria at the outset of their respective conflict. But the quality of public health was already low, and a lot of the fighting has occurred and has targeted medical facilities and other public health installations in both countries. In Syria, over half of all medical facilities have been destroyed during the war, and medical professionals are on the run, etc. And Syria has the largest proportion of IDPs and refugees of all conflicts, of all contemporary conflicts at this point. There are over 6 million refugees and around 6 million IDPs, internally displaced people. The numbers in Yemen are also horrendous. So first you have the collapse of the basic infrastructure that would otherwise help counter the spread of the virus. The second one is that you don't have the governance capacity because of the political differences, because of the ongoing fighting, etc., to have a concerted response to that, including a communication campaign, explaining to people what they need to do, etc. Fundamentally, also, you have a fundamental lack of the basic necessities that we, the lucky ones, have access to, which is water and soap, and some of the other necessities that we need to protect ourselves, and social, self-isolation and social distancing in refugee camps and in mostly destroyed cities and so on is a very difficult thing to do. So from that perspective, it's quite worrisome. You have to add to that the main funders, the big countries that have helped resource the UNHCR and other international organizations and so on that deal with refugees. They may well decide in the next period that they have to focus on economic recovery at home. And that funding for refugee, health, education, infrastructure, and so on is going to decrease significantly. So it's a cascade of problems. I mean, the coronavirus essentially will supercharge and exacerbate all the existing problems. I mean, the number of beds per capita in some of the countries is less than one bed per 1,000 people. Sometimes much less than that. So it's a quite dire situation. Going back to something that Mahsa said, just like many Iranians, for instance, have wondered why didn't Iran not interrupt flights to China early on. There are parts in the Middle East, and especially that has been the case in Syria and Lebanon and elsewhere. The question is, why were flights to Iran from these countries not interrupted? But that feeds in the current political sector and polarization in the region. I'm speculating here, but I suspect that part of the reasoning in Iran towards China is a very important country. There are important relationships to cultivate, and the economic harm would have been substantive. Right? When it comes to the Middle East the Arab parts of the Arab world, the discussion can be even more charged. Why were Shia pilgrims from Lebanon or Syria and so on allowed to return? And that is a supercharge in those very tense environments. So overall, I think what this crisis is going to do is that it's going to, overexpose and exacerbate a lot of the, structural problems, and it will show the lack of capacity of central states to deal with that. I mean, the Gulf states, which we discussed earlier, have massive financial resources. They're able to buy the masks and the tests and pay for foreign nurses and deploy surveillance technology and subsidize their industries that are hurt by this crisis. Not so in countries like Egypt, like Lebanon, like Iraq, which is also affected by dropping oil prices at the moment. So I think where the Middle East has not yet seen peak COVID. Certainly, hopefully, Iran has seen that and can put it behind. But the Arab parts of the Middle East are exposed to that. And so, the difficult days are still ahead.
Right, and both of you have now mentioned the fundamental inability of central governments to either enact measures in a timely fashion or a lack of resources on the central government's parts in certain countries. And Mahsa mentioned the role of grassroots organizations and NGOs in perhaps filling that gap to a certain extent. Mahsa, can you go in on that a little bit more?
Sure. Let me first start by saying that this issue of this virus has been from the get-go one of the pandemics that each country, even the countries with resources, I mean, we're talking about European countries or U.S., are getting a lot of criticism. Americans are outraged by how the administration is handling. I've heard British grievances of how the government responded to this virus. Italy, the same. So it's been quite an unusual issue to deal with. So I think it's only fair, while we mention all the mismanagement and mishandling and lack of resources in the Middle East, to also point out that even the world's great powers have been struggling with this, and whether it's the issue of timely response, whether how to prioritize economy versus flattening the curve of the virus. And so I think if we keep that in mind, then thinking about a region where it's not known for best governance, and add that, then we realize that it's been really a huge challenge for the countries in the region to deal with, and it's not by itself, even with resources and the best of sort of democratic states, it's not been as easy to respond in a timely and effective manner to the virus. So, but the NGOs and charities have been doing a lot of different kind of work. So those that I've been lucky enough to come across and know their work, some of them are helping, Emile mentioned the refugee camps, and I think it's really, really cannot be emphasized enough that everywhere in the region, even in Iran, the refugees have been hit the hardest. And the poor population, because people who are living on daily sort of wages just cannot afford to stay home and not go to work. And we see videos coming out of these, particularly different parts of Iran, of interviewing people. Why are you still on the street selling? And right before the New Year, imagine if this had hit Europe right before Christmas. Imagine what the impact on the businesses and people would have been compared to, it's still a huge impact, but imagine that timing, and this is what's been happening in Iran. So what the NGOs have been doing is trying to help out the families with like lower income, the refugees, etc., who just were living on a daily salary, people who were, going to construction sites or cleaning houses, etc., that now have lost their income. Try to reach out to them to make sure that they have basic sort of food necessities, so that they don't have to go out to work in groups in order to afford that. On the medical part, there was sort of one NGO called Nafas sort of built a hospital focused on this, with all the supplies, etc. Again, I keep hearing even from these groups that they have a lot of difficulty if they need to purchase any equipment from outside. the medical supplies are exempt from sanctions. So you hear that a lot, that, well, the humanitarian aid and the medical supplies are not under sanctions, so there shouldn't be a problem. That's true, but then all the financial system is sanctioned. So how are you going to pay, even if you have the money, which some of these groups have, and you want to purchase something? There is no company that will ship it, and there is no bank that will do the transaction with it. So it's been creating a lot of difficulty, even for the non-state actors who are trying to help this. And there's been a lot of infighting too. So there's been, even though they're like the known NGOs who have been working in Iran and are trusted, have been able to do some work, but anything that has, is starting as a charity, if they want to do something within the healthcare, it's been met with some resistance, with some hardline factions within the government or the IRGC who want to sort of basically keep the face of that they are able to handle the situation very well, and they don't need that kind of external help. But as I said, I think these social groups and charities have been really, really essential in helping. If there's been factories who have offered their workers to sort of divert and help, either making masks or help with the equipment, etc. So there's been a lot of sort of grassroots kind of efforts that I think has been hugely, hugely helpful in Tehran.
I mean, I take on your point that these are positive stories that should be told as well, to show that there's a sense of community and a sense of shared experience that's bringing people together. And we actually saw the same in China before the government lockdown in Hubei province took place, where local neighborhoods were actually taking it upon themselves to put up makeshift barriers and trying to control movement, and also taking care of neighbors and things like that. And we see the same here in Europe at the moment as well, in London. What about Emile?
Well, I mean, first, let me echo what Mahsa was saying at first here, which is that we have to understand that the way the virus is spreading and the responses, it's not just a matter of resources. It's a matter of trust, of communication, of ability, of leaderships to trust the science and embrace what the judgments of scientists are. It's also, I mean, and when it comes to the Middle East, these are in a way resilient societies, because they've been through so much recently, with a high sense of communal solidarity. So one would expect a lot of the responses that Mahsa was describing, and we see some of them in other Arab countries, in other Middle Eastern countries. But the problem, I think, fundamentally here is that usually when faced with adversity, the response is for people to come together. And here, the safe response is to stay at home, to isolate. And I think, there is a big contradiction between, what is ingrained in our societies, which is you look for security in numbers, by rallying, by families coming together, and so on, and what is needed now, which is essentially stay at home and try to say. And so we see a tension on this level. The second point, more to the point here, about non-state actors and so on. I think it's really interesting. States are clearly, going to face a massive challenge in the Middle East in the coming weeks and months to deal with the virus itself, but also with the second and third order effect of the virus. And so the question here is that, will people turn to, non-state actors, including in the Arab world, some of the armed non-state actors who have a social wing, and provide health and social services and so on? Yes, that's possible, and we already see, for instance, militias in Iraq broadcasting messages about, how to behave and And we see political parties in Lebanon, for instance, distributing gel and like fumigating areas. I mean, it may be totally ineffective, but at least they demonstrate publicly that they're on top and they're trying to contribute to the society's well-being. The problem here is that they are not able. I mean, this is a global challenge, and so it's not by focusing on one's community, village, city, and so on, that one's going to be able to deal with that. And you still need the convening power of a state, the ability to import the medicine, the equipment that is needed, etc. That will matter down the road. So states, non-state actors may end up actually, making things worse by eroding the image and the reach of the state without being able to fully compensate for the state's deficiencies. So it is going to be quite difficult. The NGO sector in the Arab world is not as developed as it is elsewhere. Of course, you have a lot of informal networks, and you have religious networks that provide social services, and they'll be active, but they are not necessarily the modern and specialized NGOs that can protect societies. They're much more about charity, food distribution, and so on, not necessarily about immediate healthcare responses and the kind of structural economic help that's going to be needed to jumpstart these economies that are frozen at the moment.
Maybe to end on a last question that hopefully will also be a more positive note. What do both of you see for the possibility of more regional cooperation here?
Well, I mean, we already see that a number of countries are donating, the kind of medical equipment and including masks and tests and so on to others. The question is whether this is done in the numbers that really matter, or is it just a show of solidarity, of support? Because I mean, the scale of the crisis is quite significant. I mean, perhaps as important as responding to the virus itself and the health implications, it is how to restart the economies afterwards. It's whether a variety of countries in the region can agree on measures to provide funding, credit lines, etc., but on a regional level, rather than have the rich countries focus on their own economies and let the poorer ones sink into economic disarray even more. I'm still debating, at a time of dropping oil prices and so on, what the typical regional funders such as Saudi Arabia, the UAE, Kuwait, Qatar, and so on will be able to do. And it's not necessarily clear that one will have the kind of integrated response. If the EU has struggled so much to put a package of help to countries like Italy and possibly Spain and others, then perhaps the expectations in terms of Arab countries should be low.
Yes, sure. Yeah, I want to give a few thoughts here to end our conversation. First one, following off of what Emile mentioned, I think I agree with the points, but I also want to emphasize that this is a moment that will be defining for the relationship of the countries moving forward. So, yes, there are difficulties in aiding, but I think the members of community who will not be supported enough and be left alone, it will be a choice that they will remember, and it will impact the diplomatic relations moving forward. I mean, there are many pieces coming from Italy making the same argument that Italy, might rethink the value of what it means to be part of the European Union. And I think it's a moment that it's very important to keep in mind how to respond to the needs of different countries. I mean, I was pleasantly surprised by hearing that the UAE and Kuwait in particular, Qatar also offered help to Iran, but Qatar and Iran have sort of fairly good diplomatic relations. But UAE and Kuwait have strained, their relationship with Iran is restrained, but they're still sort of offered help, and I think that will go a long way in the future of the relationship, that in the moment of need, these countries were able and willing to put aside other differences and offer help. Similarly, and so I think this provides a really important opportunity for trying to work together, trying to understand that there are issues that will require regional cooperation to respond to, such as the pandemic. So maybe that would be a starting point for building better relations and trying to resolve other issues and differences in the future. And I think another point, which Meia, you could also speak to this as well, is China, and whether how China versus U.S. or Russia, China, and U.S. are handling this in their relationship with the Middle East. What kind of long-term implications it would have, and not only in the way that they're dealing with the Middle East, the countries in the Middle East, but the way that they will handle this pandemic at home. What would this mean for the reputation of great powers and the perception that the Middle Eastern countries will have as they move towards the future, in terms of who will be able to take lead on such situation better, and who they can rely more. And I think that this is something that it's been understated, that the importance of the handling of this pandemic for the future international relations or international affairs in the region and diplomatic relations.
I think that is such an excellent point to end on, Mahsa, and one that should be discussed in future, how great power rivalry will be affected by the outbreak of COVID-19, as well as the different narratives that are being promoted in response with regards to the response of certain countries like the United States and in particular China, and how those narratives have changed over time. But that is all that we have time for today. So I will thank both of you for sharing great insights into the region, and we're looking forward to reading your further research on the topics that we discussed today from both of you over the course of the year. I'd like to thank our listeners for joining us today, and also to remind them to please subscribe to Sound Strategic for more in-depth discussions just like this. So stay safe, and see you next time.